I chose to come to Broadlawns because I wanted a first-year experience that would give me a well-rounded experience in kind of all the breadth of medicine.
There's a lot of autonomy here, and there's a lot of support, so you're not really spoon-fed or handheld, which is something that I wanted to avoid when looking at intern years anyways. And so Broadlawns really delivered on that. I ranked this place knowing that I would be able to have autonomous practice and learn as much as I can.
Probably the thing that stood out the most about Broadlawns is the culture here, and that's just not only within the residency program but across the whole hospital. We serve the needy population of Des Moines, being the county hospital here in town, and I think the whole hospital, all the staff are just very aligned and believe in the mission of Broadlawns.
Like, I got some of the best education that I've gotten just kind of from the faculty offhand during rounds or just at a table side, kind of covering a topic that comes up that day. The faculty here is really passionate, and it's very obvious that they care for their residents.
It's very much an open door policy here. They're very outgoing. They're very willing to be there to answer questions for you personally and professionally. They all kind of go above and beyond in making sure that you're doing well, both as a physician and as a person.
Both TYs and family med residents are treated the exact same. Your patient load's the same. You get the same responsibility, independence. You get treated the exact same, and I think that helps in just making you feel like part of the community and part of the program and not kind of left out as a TY. It's definitely a family here. It's definitely a community.
The other residents are kind of what made this place for me. I really enjoyed working with the other residents. There's good teamwork, there's good support, and they're just wonderful people. You
have your months of really difficult rotations where you're learning a lot, you're working a lot, but that's always balanced with the opposite side of finding your electives and being able to explore what you're really interested in. And all along the way you have faculty and other residents who are supporting you. And so I think that's been one of the biggest advantages of coming to Broadlawns for my transitional year.
You should definitely consider Broadlawns for the opportunity to become an independent, confident physician, and you should also come here for the community.
So I feel really prepared. I'm really excited to move on to the next step after finishing my year here. I think I'll start out full speed just with the breadth of knowledge that I've gained this year, and all of the encouragement from my residents and faculty behind me to support me into my next step.